Mrs. A is a 42-year-old right-handed woman who was a victim of a gunshot wound during an assault in the Texas Women's University parking lot in Houston, Texas about 8 weeks ago. She suffered a right humerus fracture and needed open reduction internal fixation. Although her radial nerve was not lacerated, she did have wrist drop for about a week following the injury and surgery that has slowly been improving. She often complains of upper extremity weakness, stiffness, and decreased motion. She also complains of pain and fatigue that are increasingly limiting her self-maintenance, self-advancement, and self-enhancement roles. Mrs. A is happily married in Sugar Land, Texas with her husband in their one-story home. They have 2 grown children, one in Austin and one in Dallas, Texas. She is a dental hygienist and her husband travels for work, so he's hardly ever home. She loves to garden, work out, and shop in her free time. She recently had a follow-up with her surgeon, who had referred her to occupational therapy for an evaluation and to begin her strengthening training.
These are Mrs. A's targeted occupational performance areas. Under ADLs, Mrs. A will work on showering. Due to decreased strength, she cannot squeeze bottles and has trouble bathing her left side. Under IADLs, she will work on meal preparation. Due to decreased range of motion and grip strength, she is unable to cut vegetables and cannot carry heavy dishes. Under social participation, Mrs. A has trouble interacting with friends. She will not go shopping due to her fear after her trauma. She was shopping when the trauma occurred. Under leisure, Mrs. A has not been participating in her leisure activities such as gardening because she's unable to plant, dig, or pull weeds due to her decreased strength and range of motion in her right hand. Under work, Mrs. A has not been able to return to work as a dental hygienist because she cannot hold her tools for prolonged periods of time due to her decreased strength and endurance in her right hand. Under sleep and rest, Mrs. A's pain level is at a 5 when she is at rest, which interferes with her sleep.
Mrs. A's long-term goal is that she will increase her wrist extension strength from a grade of 3 to 5 in order to improve her ability to manipulate her dental tools independently within 6 weeks in order to return to work full-time. Her first short-term goal is that she will complete grooming tasks with modified independence using a universal cuff on her right upper extremity within 2 weeks.
Her second short-term goal is to cut vegetables for 15 minutes without breaks under supervision using energy conservation techniques to help reduce fatigue within 2 weeks. Her third and final short-term goal is to increase her palmar pinch strength from 4 to 8 pounds with modified independence to enable her to hold and use her work tools within 3 weeks.
Using the OTPF as a reference, we will now review how Mrs. A's weakness in her right upper extremity and her lack of endurance have affected her occupational performance. First, under performance skills, accommodates, handles, and paces have all been affected because she is no longer able to handle her gardening and dental hygienist tools. Her weakness and lack of range of motion in elbow extension and flexion, as well as supination, also affects her motor skills of reach, gripping, moving, manipulating, and coordinating movement. Under performance patterns, Mrs. A has also made modifications in her routines, such as her morning routine, because she has had difficulties with performing ADLs, such as bathing, grooming, dressing, and functional mobility. Her shopping routine has also changed, as she now avoids this activity due to her traumatic event, which occurred at the grocery store. Mrs. A's roles as a wife, mother, gardener, and dental hygienist have all been changed. She is unable to hold her dental hygiene tools for lengthy periods of time at work, nor can she perform the complex, coordinated fine motor skills required. She also has trouble with her IADLs, such as meal preparation and carrying dishes. Therefore, she is not able to fulfill her responsibilities at home. Finally, She can no longer perform her role as a gardener because she cannot hold her gardening tools. Many client factors have also been affected by Mrs. A's weakness and endurance. Under global mental functions, energy and drive are diminished because Mrs. A can no longer perform duties requiring wrist extension. For sensory functions, pain has been affected. Mrs. A reported a 5 on the numeric pain rating scale at rest and increased to 6 during ADLs and 7 during work tasks. Under movement-related functions, her muscle power, muscle tone, muscle endurance, joint stability, and mobility have all weakened. Mrs. A also has limited range of motion and elbow extension and flexion as well as supination, which limits her reaching capabilities. Finally, the activity demands affected by her injuries are objects used and their properties, as well as their required actions and performance skills. The motor skills of endures, grips, manipulates, reaches, and coordinates are all required to meet these activity demands, which Mrs. A currently lacks. Her injuries have also altered Mrs. A's physical and social environment. Mrs. A once enjoyed shopping as a leisure activity, but due to her psychological trauma she experienced from her gunshot wound, she is now afraid to go shopping, which affects her social environment.
So for frame of reference, we chose the biomechanical model. This is because this model addresses musculoskeletal related diagnoses or disorders. If you look at the intervention, Mrs. A's intervention will be focused on wrist strengthening, which requires knowledge of anatomy, physiology, and even kinesiology. The use of this frame of reference is in line with the long-term goal of increasing wrist extension strength of Mrs. A. And our approach is to establish and restore, that is, return wrist extension to grade 5. It is currently at a grade 3. And also to modify, adapt, or compensate. Mrs. A is going to have to use a rotator cuff and long-handled sponge.
These are the interventions that we chose for Mrs. A. Assistive device education, including a long-handled sponge for bathing and a universal cuff for grooming. Energy conservation education in order to prioritize the activities of the day as well as deep breathing exercises. We included wrist strength using the TheraBand and pinch and grip strength, including using a squirt bottle to water plants as well as pulling weeds or vegetables from the garden using a palmer grip.
Based on our findings, we believe that the practice setting that is most suitable for Mrs. A is an outpatient hand clinic. She will attend this clinic 2 to 3 times a week for 1-hour sessions. She will have a follow-up eval in 6 weeks to see where her status is.
Okay, she looks at it.